And the first focus will be dedicated to inflammation. I will speak about acute inflammatory processes, and even more, I will speak about low-grade chronic systemic inflammation. That is the common matrix of the most part of diseases. Think that in 2004, Time dedicated the cover to inflammation, and the title was The Silent Killer. Subtitle, the surprising link between heart attack, cancer, Alzheimer, autism, and inflammation. So if we'll be in the position to rightly manage the inflammation, the goal of this seminar will be reached. And clinical trials and clinical applications. So this is the big menu of today. And this is the triangle of the therapy, that is the symbol of physiological regulated medicine, that is an expression of low-dose medicine. With PRM, physiological regulated medicine, we try to cure the human being and not only the disease. That is something that is not only our goal, but for instance, the typical goal of homeopathy. To act on the causes and not just on the symptoms, really, because we act on the imbalance on the psychoneuroendocrine system. And to consider the human being as a whole, mind, body, and in his individuality. So it's really a human-centered medicine, is a tailored medicine. We come from the tradition of homeopathy, but low-dose medicine is something different. But something very nice in that approach is also in our medicine. I will propose to you some protocols, therapeutic protocols, and you will see always that I will give you some suggestion about drainage, PNEI rebalance, and the treatment of symptoms. You can see that the blue part, the base of this triangle, is the drainage and the detoxification. I can say that a good drainage in every therapy, especially in chronic diseases, is a half of a good therapy. If you detoxify the body, and especially the most important tissue we have, the extracellular matrix, you will see just draining and detoxifying your patient changing his condition, at least for the 50%. But since our goal is not only to give relief to symptoms, but to deeply act on the cause of the disease, the core of our medicine, beside the drainage, will be to rebalance the psychoneuroendocrine immune network. And we can do that in just one way, that is using the signaling molecules as medications. You can see two arrows because today I will focus your attention on understanding how to use the PRM medication to drain and to rebalance the PNEI axis. Okay. This is an example of therapy. This is the goal of our seminar. For instance, in case of respiratory allergy, first of all, we treat patients with a drainage. In this case, you can see that we use a drug. For some of you who don't know what is Guna matrix, is a very powerful detoxifying drug that acts on the extracellular